In this station, in the SIMMAN confusion, actually it's a SIM woman, not SIMMAN. The task say that this patient has been admitted 3 days ago because of UTI, and she has been receiving antibiotics for it. And right now, your nurse colleague noted that the patient is feeling unwell. So address the patient or manage the patient. You will enter the cubicle, you'll find the patient totally confused. When you find someone confused, do not move to the D. Always start at A, B, C, D. This is emergency. So always start with ABC. So introduce yourself, look at the monitor. You can find the oxygen saturation is low. So rule out smoke or cough and give oxygen. How are you feeling right now? Still moaning. Okay, this means that I have to move to the breathing portion. Actually, in the breathing, you can listen to the crepitation sometime. In the crepitation, this means that there probably could be chest infection. Usually in the emergency, we don't do full chest examination. It's very enough to do inspection and auscultation. And in the auscultation, you will find crepitations. Okay. Also assess the trachea, if ever, and you will find it central. Okay, now move to the C. The C, there could be hypotension sometimes. Okay, in the hypotension, you will attach two wide bore cannulas. But there is a problem. In this case, you knew that she is chest infection. Why? I forgot to tell you that in the monitor, you will find that the patient is having high temperature, like 38.5 maybe. So 38.5 plus crepitations in the chest plus low oxygen, this means that there could be sepsis, right? And in the sepsis case, we need to start within 1 hour. I mean, it's not like high grade emergency. I mean, it's not very essential that you start right now. It's recommended that you start within 1 hour or like as soon as possible, but not right now. It's not hypovolemic shock. So in the sepsis, you don't usually start the IV fluids right now. You can delay it till the end of your station, because you will speak to the management of the management, or you will address the management to the examiner. So in the C portion, actually what you will find right now, you can find low blood pressure. If you find low blood pressure, you will attach two wide bore cannulas, and you can say, I need to attach fluids to my patient. Which fluid? Hartmann solution. But here 500 milli is very enough. Not necessarily 1 liter, and over 10 minutes. Hartmann solution, 500 milli over 10 minutes. Okay. Move to the D portion, which is very important. The patient is confused. Start doing the GCS. You will find a grade of confusion, like the GCS is below 14 here, definitely. And measure also the blood sugar, as we agreed before. In the D, always blood sugar comes. You will find it normal. Okay. Now, a very important thing. Very, very important. Look at the catheter. There is a urinary catheter attached to the patient. There is no change in the color of the urine. Okay, so now I'm going to do some investigations to my patient. Which investigation I need to do? I need to take, like, you will say about the all investigations of the sepsis. First of all, I will do full blood count. I will do LFTs and KFTs and thyroid function test. I will do clotting screen. I will do ABG. I will do also blood culture. One important thing also is that I'm going to do the urine dipstick and chest x-ray and ECG. In the urine dipstick, the examiner will tell you, doctor, your urine dipstick is negative. Okay, so this means that there is no current urinary tract infection. Actually, this woman is having sepsis due to chest infection right now, evidenced by the crepitation. So the urinary tract infection has caused sepsis. Here she caught sepsis, or she caught respiratory tract infection while staying at the hospital. So this woman is having, the main problem in this woman is respiratory tract infection. The urinary tract infection usually was cleared, evidenced by the urine dipstick, which is negative. But the problem here is that she caught chest infection while staying in the hospital, which could be hospital-acquired pneumonia. Okay, so right now the examiner will tell you, doctor, what's your diagnosis? I'm suspecting that my patient is having sepsis. Why sepsis, doctor? Because the patient is having high-grade fever, above 38. This is number one. Number two, the patient also, you will say that my patient is having at least two of SIRS criteria, which are number one, the temperature is high temperature. Number two, the patient also has got tachypnea. You will speak about the tachypnea in this case. One other important thing, you will say that the sepsis actually here is due to chest infection. Why chest infection? Because of shortness of breath and crepitations. Okay, what are you going to do? The patient actually is having low oxygen, and this or was having low oxygen, and this is one high risk criteria. The high risk criteria is low oxygen below 91. This is number one. Number two, if the lactate is above 2, if the systolic blood pressure is below 90, those are usually the high risk criteria, and I see that this patient fulfilled these criteria. So this means that the patient is in high need, and usually most of the patient in PLAB 2 will need like action within 1 hour. In sepsis cases in PLAB 2, usually they will need an action within 1 hour. So in any high risk, you will say that the patient needs an action within 1 hour. What will you do within 1 hour, doctor? You will say that I will take 3 and give 3. I will take blood sample from the patient, which I already mentioned. Number 2, I will take urine culture and sensitivity, which I already mentioned too. Number 3, I will do fluid chart, and I will do serial lactate to my patient, and I will monitor the urine output by inserting urinary catheter to my patient. And what will I give to the patient? Number 1, I give oxygen. Number 2, I will give IV fluids, Hartmann solution 500 ml over 10 minutes, and I will assess it. And I will do serial lactate. Okay. And number 3, I will give antibiotics. In the antibiotics, usually I will give according to hospital protocol. If the examiner insists on you, say I will give IV clarithromycin, IV co-amoxiclav 1.2 gram TDS plus clarithromycin 500 milligram BD. Okay, so both things are IV. But here, keep in mind that this patient is having chest infection, not urinary tract infection. This is chest infection case. This is sepsis due to chest infection, and it's not simply pneumonia. It's sepsis. I mean, sepsis is higher grade than pneumonia. Pneumonia is simply chest infection, but here this patient has already developed sepsis. Okay. Okay, doctor, what will you do after the next 1 hour? Simply, I will reassess the patient lactate and the blood pressure. If the lactate is above 4 and the systolic blood pressure is below 90, this means that my patient is going into septic shock, so I will need to call the critical care team. So usually after 1 hour, we will assess the lactate, because we will measure the lactate every 1 hour. So after the first hour, we will measure the lactate. If it's above 4 and if the systolic blood pressure is below 90, I will need to I will need to call the critical care team, because this means that my patient is going into septic shock. So this is the whole station, and please always mention that the patient is in sepsis, not simply pneumonia.